Hello, welcome back. The topic today is uh, can gastric ulcer recur? So, most of the people ask us, Doctor, I've been treated for gastric ulcer or duodenal ulcer and I've been completely cured. Can it recur back? The answer is definitely it can. There is a possibility, but the most of the time, the reasons for the recurrence of the gastric ulcer or a duodenal ulcer is mostly from the patient's side. What is that? Most of the time, the lifestyle modifications which was advised to them, they don't follow. The first initial 1 month, 2 month, 3 month, they will follow that, but after that, they get back to their original, lifestyle. So that could be the first reason. Simple reason is, see, the sleep is very, very, very essential. At least 7 hours of good sleep, the pitch dark, in the night time, in the pitch dark, they should sleep for 7 hours, because that's the only time where the night time the acid level is very low, almost nil. But if they don't sleep at all, then acid will start secreting, and it will erode the stomach and cause ulcer to come back. This is one part. Second part, late night food, late night heavy food like biryani, calorie rich, oil rich, these can trigger the ulcer recurrence. And after having food, immediately going to the bed, we are already told at least keep 2 to 3 hours of gap. Without that, they go to the bed immediately. That can cause. And obesity is one of the main reasons for ulcer to recur back. So they have to maintain their lifestyle to reduce the weight, also keep the weight in the check. This is also very important. Or stress, so unnecessarily worrying about something, fear, panic, you know issues, depression, all these things can cause the ulcer to come back again. So this is the lifestyle is the first and foremost reason. The second reason is, uh, uh, what is the root cause for the gastric ulcer? Because ulcer happens for so many other reasons. The first and best example is H. pylori, Helicobacter pylori infection. So it's a common cell in the stomach that can cause ulcer, gastric ulcers. So suppose the ulcer treatment was given, but the H. pylori treatment was not given. So it will come back after few months. It will come back. Ulcer can come. So that is why endoscopic biopsy to rule out, to look for what is the root cause of the ulcer is very important. And the other reasons, like people who are taking painkillers, NSAID, we call that painkillers mainly. If they are taking for some reason, suppose they had a fracture, if they take for some days, okay, they stop, probably it will heal. But for some reason, people, for the headache, they will, they self medicate themselves for the headache, knee pain. If they take chronic, for the pain part, if they take painkillers, the ulcer can come back. This is also very important. The next is food. That is very, very, very important. So most of the people know what to eat, what not to eat. They all know they should avoid heavy meals. They know heavy calorie food, oil food, avoid oily food, spicy things. They all know. But most of the time, the food discipline means timing of food is very, very important. So if suppose you have a 7 hours of good sleep, the moment you wake up, at least within 30 minutes to 1 hour, you should have some solid food. Because if you don't eat solid, the acid will come and erode your stomach. So ulcer can come back. So if you have a solid food, this acid will attack only the food, not the stomach. So this is very important. So we say, so 8 o'clock or 7:30 to 8 the breakfast, 10:45 11 mid morning snacks means from fruit salad or vegetable salad, something like that. 1 o'clock lunch, 4:30 some sundal something, or vegetable salad something. On 7 o'clock dinner, and 10 o'clock sleep. So this is also very important. And other reasons, like suppose somebody is taking medications for some diseases like diabetes, hypertension, cholesterol, or thyroid. These medications all has to be taken for years together or even lifelong. So when they take, especially thyroid medicine, they have to take it in empty stomach in the morning. And if they take the thyroid medicine empty stomach morning for years together, so the ulcer can come back again and again. Or even diabetic medications like metformin, they're wonderful medicine, they're lifesavers, but they can cause ulcer to come back. And there are other reasons for the recurrences. Anemia, suppose the patient is already anemic and if they're taking medicines, definitely the ulcer will not heal. Because if any wound has to heal or some tissue repair has to be happen, you need hemoglobin at least 11 to 12 grams. This is very, whether a male, female, 12 grams of hemoglobin is essential, plus nutrients. Those are very essential for ulcer healing. So if your ulcer recurs, first always retrospect from your side, your lifestyle part. Then you go back to your doctor. He will examine. He may try to find out what is the reason for recurrence, and he can give a solution. Like they will do again. They will do the same kind of test like your uh, endoscopy, ultrasound scan, all these things, and they can give you a simple good solution. Thank you.